Hi there. Thanks for being with us for the second webinar in our series on mental health education. My name is Leah Landry. I work in communications and advancement at the Massachusetts Association for Mental Health. MAMH, as we call it, is a statewide nonprofit committed to making sure people have the resources and opportunities necessary to protect their health and well-being. That includes mental health. Each day, MAMH brings people together to achieve that goal by sharing information, lending expertise and insight, and advocating for change. The goal of this training is to help you understand trauma to protect and maintain mental health. We have more trainings like this one available on our website, mamh.org, along with several other mental health resources. This training is focused on increasing our understanding of mental health. One very common challenge to our mental health is traumatic experiences. This session is going to focus on defining trauma, understanding the various types of trauma and their impact. We're also going to explore how a history of trauma can affect how we care for or interact with others. And finally, we'll learn strategies to develop resilience and more about how to find resources and supports. Trauma is defined as exposure to events or experiences that threaten personal safety. It can include the presence or even the perception of a threat. Trauma can be something someone personally experiences or witnesses, and something that we're more indirectly impacted by. When we're exposed to trauma, we can feel powerless, fearful, hopeless, or be in a constant state of alert. There are many potentially traumatic events, some of which are listed here. Again, you'll notice that some are more personal experiences, like abuse or neglect. These can be single experiences or repeated over time. Others can be collective experiences, like a natural disaster or war. And still others can be related to potential threats to safety or ongoing threats, like living in an unsafe neighborhood or experiencing domestic violence. Trauma has a significant impact on the brain. When we're young, we're especially vulnerable to trauma because our brains are still developing. First, trauma activates a part of the brain called the amygdala. It's the part that recognizes and responds to fear. Our automatic response to fear is either fight, flight, or freeze. Additionally, the body is flooded with adrenaline and cortisol, which disrupts executive functioning, things like memory, attention, problem solving, and planning. Trauma can create a deep imprint in the architecture of the brain, especially in younger people, and when the fear is persistent or prolonged. These experiences can lead to hypersensitivity to threats and a constant state of alert. This is often referred to as toxic stress. As we age, a history of trauma can have a lasting impact on our sense of safety and make us feel more vulnerable. When trauma is complex, meaning it includes multiple experiences over time, childhood trauma can have a negative impact on our physical and mental health and interpersonal relationships well into adulthood. It can affect how we act, especially down the line as parents and caregivers. When we consider long histories of trauma in communities of color, it's not surprising that people who identify with groups that have experienced generations of discrimination might mistrust others or entire systems. Addressing our own trauma experiences is incredibly important to maintaining mental and physical health, as well as being able to support our friends, families, and loved ones through their own challenges and adversities. So how can we understand traumatic experiences? It's important that people have the opportunity to share the story of a traumatic experience as a way to process the event. As a listener, it's important to be emotionally present and able to offer support, but that can be difficult. The first step is being self-aware. Ask yourself if you're emotionally able to hear their story and offer support. If not, reassure them that you want to help, but acknowledge that this is painful for you too because you care about them. Work together to identify someone who can help. It may be a trusted friend or family member, or a professional trained to help people through grief and trauma. If you feel you're ready, provide a safe space for them to tell their story, but let them take the lead. Allow them to choose the time and location. Maybe there's a place that brings them comfort or allows them privacy. Alternatively, ask if they want to do something while they talk, like drive in the car, sit on a swing, go for a walk, even bake cookies. These activities can provide a distraction if necessary. Be patient. It may take time for you to hear the whole story and their true feelings. Remember, this is a process, and in some situations, it may be the first time they're acknowledging a traumatic event and the resulting pain and injury. Focus not on the details of the story, but on providing reassurance that their feelings are valid. You don't need to fix the problem. Just listen and be supportive. In addition, it's okay to share your feelings. Just be careful that you don't say something that might add to their burden. Depending on the situation, it may be necessary to limit news or social media, particularly if the trauma was a public event or when information or misinformation is being shared among peer groups or on social media. And finally, provide them a voice in identifying how you can provide support. As someone processes a traumatic experience, parents, friends, and caregivers can provide additional support by helping them build resilience. Resilience is the ability to recover from adversity or challenges. Sometimes who we are, our personality, or our characteristics promote resiliency on their own. That said, it's also something that can be learned and cultivated with practice and support. People often benefit from having a variety of supporters, particularly among different settings like home, school, and in peer groups. Developing a narrative to inform potential supporters of your experience and needs can be helpful. Explore questions like how much each person needs to know and how the individual can be supportive. Having a strong support network helps build resilience. Another way to help promote resilience is to identify and develop coping strategies. Self-awareness can help you understand your emotional and physical response to stress. We know that stress can manifest in emotional, physical, social, or behavioral disruptions. For example, some people may become angry or cry. Others may develop headaches or feel very fatigued. It's not uncommon for people to withdraw, even from their supporters when they're struggling to manage stress. And finally, others may engage in risky or unhealthy behaviors like using drugs or alcohol. The sooner a person recognizes they're feeling stressed, the more likely they are to utilize positive coping strategies. In addition, practicing techniques like mindfulness or grounding exercises help you stay in the present moment, manage negative internal dialogue, and practice self-care as part of a regular routine. Despite self-awareness and a set of strong coping strategies, sometimes we still need to seek help. With time, you can learn to recognize that when stress and anxiety get in the way of carrying out activities of daily living, like sleeping, going to school, or completing chores, or when the activities and supporters that used to help are no longer feeling effective, it's time to seek a trusted adult and ask for more help. Another added bonus, keeping open conversations about emotions, trauma experiences, and the effectiveness of coping strategies helps to reduce stigma associated with mental health challenges. There are many crisis support resources in Massachusetts that are available for free, 24/7 for anyone who needs help. You can call if you're feeling like you need someone to talk to, or if you're having trouble coping with your feelings, or feeling like you don't have any other options. You can also call on behalf of a loved one, family member, or friend. You can utilize the Behavioral Health Helpline. It's available 24 hours a day, 365 days a year by phone call and text. You can call 833-773-2445 or use the online chat at masshelpline.com. Thanks for being with us today to learn more about trauma. Our next webinar in this series will teach you about grief and loss. Learn more about mental health and your experiences on our website. We have mental health education resources and more trainings like this one at mamh.org.